Hello, it's Dr. Rhonda Johnson, and today is Tuesday, February 2nd, 2021. Today I'm going to be talking about the inequity so far in the COVID-19 vaccine distribution. Well, we know that African Americans account for about 15% of the general population here in the United States and have made up about 39% of COVID-related deaths. We know that people who are at highest risk for infection and death are African Americans, Hispanics, and indigenous people, the Native Americans and the Alaskan Natives. We know that men have a higher rate of dying and a greater risk of death than women. So we know folks who is at the highest risk. Now, who's getting the vaccine? That's a different story. A report from the Centers for Disease Control was published yesterday in the Morbidity and Mortality Weekly, the journal from the CDC. And it shows a different story about who gets the vaccine. So they looked at the first month between mid-December and mid-January of vaccine distribution here in the United States. And they looked at nearly 13 million people who received at least their first doses. And they found that 63% were women, 55% were over the age of 50, and 60.4% were white, according to the CDC report. Now keep in mind that the first phase of vaccine rollout across the country and in most states were for healthcare workers and nursing home residents, more or less. Some states did it a little differently. However, national data, according to the CDC, shows that African Americans receive 5.4% of shots, with data showing that they made up 16% of the healthcare workers and 14% of the nursing home residents, the two groups that were prioritized for this first wave of shots. Now, Hispanics are doing better. They received 11.5% of the shots, according to the available data, while they made up 13% of healthcare workers and 5% of nursing home residents. So no matter how you look at this, the data so far shows that Black Americans and other non-white groups are not being vaccinated at the same rate as white Americans. Now, a lot of data is unknown by race and ethnicity, but my educated guess is if the race and ethnicity data had been collected for everyone who received shots, it would show an even greater imbalance. Now, let's bring it on home. Let's look at what's going on in Pennsylvania, because that's where I'm at. So we have had over 820,000 people vaccinated. That's partial and complete. And of this 820,000 people, over 820,000, roughly 12,700 people are African Americans. A mere 1.5% of vaccinations were the race and ethnicity, of known vaccinations, 1.5%. Now, again, they don't have data by race and ethnicity on everybody who got vaccinated. But again, it's not anything where it should be. Now, there's a lot of talk on the news about vaccine hesitancy and African Americans being reluctant to receive the vaccine. But there are many African Americans who have made up their minds and who want the vaccine. I know because I do a lot of community outreach and I talk to a lot of different groups of people, and the interest in the vaccine is very high. And I hear people asking me all the time, how can I get a vaccine? Now, what I do know is that I can't tell them how to get a vaccine. There's a lot of confusion about how to register for the vaccines, where they're going to be given, who's giving them, who has vaccine, how to sign up, where to sign up. And when people go through all of that, the appointments are often already taken. So what do I know and what would I suggest? I suggest that everyone who wants the vaccine go to and become familiar with the Pennsylvania Department of Health website here in Pennsylvania. To be vaccinated, you have to be eligible for vaccine. You have to be 75 years and up, a healthcare worker, or live in a long-term care facility. You need to have your insurance cards pre-scanned to your computer. They do have a 24-hour, they have a number to call, a toll-free phone number. Also, I suggest asking your doctor's office, where can you get a vaccine? If there's a sign up, go ahead on and sign up. The wait time may be long, but register anyway. Now, some of the federally qualified health centers and community clinics have vaccine. They're more likely to have the Moderna vaccine because it doesn't require the deep cold storage. Some pharmacies, Giant Eagle, independent pharmacies, and Rite Aid have vaccine, but I suggest you call first or look on their websites. The Biden administration says they're going to be giving out more vaccine to pharmacies effective February 11th, so next week there may be more vaccine available. If you're a veteran, you should have been notified by the VA that they have walk-in clinics and they take according to your last name. Why is it so important to find out about these vaccines? What is the rush? Well, the rush is the race against these variant viruses, those mutated viruses. They may not be as susceptible to the vaccines as the original wild strain. We've heard about the UK, the Denmark, the South African, the Brazil variants, but there are more variants circulated. The amount of virus present in most communities is high, and it's unknown if all these variants have the ability to spread more quickly in people. We know that the UK variant does. Whether or not they can cause more severe disease in people, whether or not they can evade detection on these COVID-19 diagnostic tests, and also whether or not these variants have the ability to evade natural immunity or vaccine-induced immunity. So this is why there's a push to get people vaccinated. Now, we've already seen in this COVID pandemic that when this disease gets bad, it's really, really bad. So, sad to say, we've had inequity in the burden of disease, with disproportionate burden among Blacks, among Latinx, among indigenous people. We've had the same inequities in testing that we're seeing in the vaccine. We may have ongoing inequity in treatment. The case of Dr. Sandra Moore highlighted that. Susan Moore, rather. And now we have inequity in vaccine access and distribution. I know people say, when will this ever get better? But folks, I do have a reason to believe. And I want to encourage you, don't give up. Don't be frustrated. I know it's not going to be easy to get a vaccine because supplies are limited. But, stand up for ourselves. We have to stand up for ourselves, and we have to make sure we have the opportunity to get this vaccine. So, you may want to contact your health department, contact your civic organizations, contact your advocacy groups, contact your elected officials, get some activism going to ensure access for people who need and want this vaccine. I know everybody's not going to take it, but that's true for all ethnicities. Also, sign up for alerts too, so you can receive notice. Many of the TV stations are aware of vaccine distribution sites and publicize this information on their social media sites. They broadcast it and on their websites. So I've been talking about think, planning, and acting. Well, now we have to act, and we have to act quick. So folks, stay tuned. As soon as I get more information, I'll be sure to share it. But in the meantime, continue to practice your prevention. And if you hear about vaccine distribution sites and availability, be sure to share it and pass it along, word of mouth. to other people who need the vaccine. This is Dr. Rhonda Johnson. My views are my own, and stay safe and have a blessed day.